This is a Dutch testing report tutorial to assist you with the interpretation of results. These are not intended to be for medical advice, just for educational information only. The results that we'll show are not your patient's results, they're not your results, they're just sample results to move the conversation along. As we're looking at the cortisol, one of the most important things that we want to look at is the free cortisol pattern over time. So we're looking at those 4 measurements, and then we're going to add them all up. And in this case, we want to look really closely at this because the total of these 4 is extremely high. So then there were a number of situations that we could be looking at here. In this particular case, as we look at that, we've got a little bit of an oddity in that the results are very, very high for free cortisol, but the metabolized cortisol, which is really your better marker for total cortisol production, is not elevated at all. It's either within normal or actually low. So the degree to which that is low gives us a bit of a dichotomy, some contradictory sort of messages, in that the free cortisol, again, it's only 1% of the total, but very, very high in this situation, but the total production is relatively low. So we want to confirm in a case like this what's going on with cortisol by looking also at cortisone. So the brain makes a signaling hormone called ACTH. When the adrenal gland sees that, it makes cortisol. When it makes cortisol, it then circulates as both cortisol and the inactive form cortisone. So because it circulates as either one, we want to look too at the free cortisone pattern. So in a case like this where the free cortisol is very, very high and the metabolites are not, then looking at cortisone can help rule out things like contamination. Let's just say, for example, the patient is taking hydrocortisone cream and they get some on the sample. Hydrocortisone is cortisol. So if you get this very high value in 1, 2, 3, or 4 of those situations and you don't see a corresponding elevation in cortisone, it could be because of contamination potentially. So that's a good thing to rule out. Again, especially because the production, the metabolites are telling us there maybe isn't that much cortisol overall being produced. So then, of course, you want to ask the question, how did the free cortisol get so high? So the free cortisol is made, back and forth with cortisone it goes, by way of an enzyme called 11-beta-HSD, and then it's metabolized to cortisol and cortisone metabolites. So in a case like this where the free cortisol is very high and the metabolites are not, it implies that maybe there's quite low cortisol metabolism or cortisol clearance, which you'll sometimes see in a low thyroid patient, potentially if there's poor liver function. In other cases, you might see the opposite, where the cortisol in its free form is relatively low and the metabolites are relatively high, which would tell you, wow, the cortisol is being cleared or metabolized really fast. You'll see that in obesity, elevated thyroid, long-term exposure to elevated cortisol, that sort of a thing. Again, in this case, it's quite the opposite. So the other thing that we can see here, and this is really important in a case like this, is which predominates, the active cortisol or the inactive cortisone. So when we want to look at that, of course you look at this and say, well, look, the cortisol is so high. If the cortisone isn't also very high, which it may or may not be, then that implies that if the cortisone's not so high, it implies there's a preference for cortisol, right? But the best way to look at that is to look at the metabolites. Do we have more cortisol metabolites than cortisone? You would expect that if the free cortisol is really showing high cortisol and not so much the cortisone, that the metabolites would say the same thing. And if they don't, then again is where we want to investigate a little bit in terms of making sure there's not contamination or some other reason why the results would look a little bit weird that way. If there's a deactivation overall for cortisone, then that adds to the picture as well. So in this case, if it points more towards cortisol, then it might make sense that these very high free cortisol levels, that maybe the cortisol is just not clearing the way that it's supposed to. So if you get the cortisol predominating in its active form and you seem to have low cortisol clearance, then it's probably worth exploring a little bit more, whether maybe there's a thyroid component to this or something of that sort. So we want to look at the overall picture. It can get sort of complex in some cases like this, but we want to look at the free pattern over time, the total of production, and then any metabolic preference that there might be in piecing all of that together. So I hope that's been helpful. If you have other questions, you can see our other educational information at DutchTest.com. If you have questions from the patient perspective, please do see your healthcare provider for those, and we thank you for testing with us.